Bismillah ar-Rahman ar-Rahim. Hi dear third year medical students. We will discuss today protein in the third lecture of our nutritional series in community medicine. First of all, what is protein? As you know, protein is one of the important component in our bodies, and it is a vital component to the human tissue. That's why its name is derived from the Greek word which means of the first importance. It is a complex of nitrogenous compound and made up of 20 different amino acids, and there is a peptide linkage in between these peptide or amino acid sequences. What's the classification of proteins? There are three types. We have simple protein, conjugated protein, and derived protein. Simple protein like albumin and globulin. Conjugated, there is a protein added to certain compounds like nucleoprotein in RNA, DNA, and mucoproteins and glycoproteins. There is protein and polysaccharide or mucin addition to the protein. Lipoprotein, lipid will add it to the protein like triglyceride, cholesterol, very low density lipoprotein, high density lipoprotein, and phosphoproteins, in which there is phosphoric acid added to the protein as in milk casein and the egg yolk, and metalloprotein when there is metals like ferritin, copper, or zinc added or attached to the protein. These are the conjugated protein, which is second type of proteins. And the third one is derived protein as peptides. Peptides is various stages of protein metabolism. So what's the function of protein? The protein is important for synthesis of tissue and special metabolic function. The protein found in dietary products. And it also plays a role in anabolic process for build up and maintain body tissue, to keep up and to replace and to maintain growth, and also for energy source, but it is an expensive energy source. When there is deficiency in carbohydrate and fat intake, the body will use protein for energy, and also to play a role in structural formation like formation of hemoglobin, enzyme, hormones, and various body secretions, and in immune function also as a protection of antibody. It composed of proteins, and it play a role in transportation like that of triglyceride, cholesterol, phospholipid, fat soluble vitamins, and drugs, and also play a role in homeostasis as it maintains the normal osmotic pressure among body fluid. Whenever there is reduction in protein content in the body, it will end with edema production, and also it maintains the appropriate pH as it play a role as a buffering system which control acidity, and detoxification deliver for drugs, for toxic food or toxic drugs. The amino acid classification. There are essential amino acid and non-essential amino acid. Essential is an indispensable, IGAA, indispensable amino acid. The body synthesis but in inadequate amount, insufficient amount to meet the metabolic need. So they should be supplied from outside, from the diet. And if they are deficient in our body, the essential amino acid will cause a negative nitrogen balance. There is weight loss, impaired growth in infant, and with the clinical symptoms. And for example, as prolonged histidine deficiency will cause impaired in hemoglobin formation and certain disease with it is a clinical sign and symptom. So we have to know essential amino acid, or we call it the indispensable. They are insufficient, and their deficiency causes a lot of signs and symptoms and negative nitrogen balance. Non-essential amino acid, they are dispensable and can be synthesized in the body. For example, glutamine, glutamate, alanine, and aspartate. Conditionally dispensable amino acid can be indispensable under certain clinical conditions, as in premature infant like taurine, cysteine, and sometimes tyrosine. They are indispensable under certain conditions. And we have the arginine may become essential in malnourished patient, in septic patient, or during recovery from injuries or surgery. What do you mean by high biological value protein? That's the protein that contains all the essential amino acid and in a right and proper amount for building tissue. These include meats, here chicken, fish, eggs, and cheese. These are high biological value protein. What is the complementary food for protein? Complementary food, we need it when there is deficiency of the protein content in our body. Usually, a diet which is high in animal protein can provide adequate amount of indispensable amino acid for efficient protein synthesis. So the animal protein product is enough if we take it in enough quantity. When we eat meal with a mixture of food in sufficient amount, means in good amount, the various protein tend to complement each other. So we may not need to add other complementary protein. If we take a meal with a mixture of protein content, it will be complemented each other. But the principle of protein complementary applies to diet if there is cultural, religious, or economic factor that restrict the amount of animal protein intake availability. So how would they complement the inadequate protein diet? How to complement that? By eating a variety of food combination of food that contain mixture or a different amount and different type of protein is sufficient to complement each other if they are given in a good quantity and quality. For example, eating large amount of cereals of protein, it is lack of one essential acid like lysine, and this type of cereals like rice or wheat, and they might cause deficiency in lysine. But if we give in addition to that legumes, also it is lack of methionine, and the legumes like beans, chickpeas, lentils, this will overcome the shortage of a protein of the lysine. So we have to give together wheat protein or cereal protein in addition to legumes, and these will act as complementary protein diet each other. And sometimes to overcome the shortage of a protein, we may also add a small amount of meat to cereals diet, also to complement the inadequate protein intake. Protein in food, there are complete protein food. They contain all the 9 essential amino acids in sufficient amount in the quantity and in ratio for the body need. For example, milk, egg, meat, they are the animal source of a protein. They are complete protein food. While incomplete protein, they contain deficient amount in one of more of the essential amino acid. For example, the cereals, the legumes, and seeds. When they take alone, they are deficient. But when they are combined together, they form a complete protein food. So we have to combine 2 or more of 3 types of this incomplete protein food to have a complementary diet. So what are the types of protein in our body? We mean the tissue protein. There is structural protein like collagen and connective tissue proteins, contractile proteins as in myosin in muscles, antibodies as in immunoglobulin, and blood proteins like albumin, fibrinogen, and hemoglobin. There are hormone protein like insulin and thyroxine, and we have the enzymes lipase and pepsin. So we will talk now about the nitrogen balance. What do you mean by nitrogen balance? Because proteins are only nutrients that contain nitrogen, there has been a strong relationship between nitrogen input and the output in the organism. So nitrogen balance is equals to the nitrogen intake minus the nitrogen output, and the output either in the urine or feces or in the skin through the sweaty glands. So the nitrogen balance equals to the input minus the output, urine, feces, and the secretion of the skin. Their difference may be positive, may be negative, or may be zero, as there is normal equilibrium. And this is, as we said, the equation. The balance equals to the input minus the output, and the output, as we said, it contains urine, feces, and the skin or the dermal loss. In normal adult, the nitrogen balance will be normal. It is equal between the input and the output, while it is positive for the intake when there is during pregnancy, childhood, pregnancy, infancy, childhood pregnancy, and during convalescent period, if adequately nourished. While it is negative in patient following injuries, major trauma, fever, illness, cachexia patient, or patient with malignancy, because of an increased catabolism of the body protein stores. So as we said, nitrogen balance will be positive when the synthesis of a protein more than degradation. This occurs in growth and bodybuilding. While it is negative when the synthesis is less than degradation. Degradation is more. There is destruction of a protein as in patient with starvation, trauma, cancer, cachexia, and so on. Equilibrium, the synthesis is equals to the degradation. Any healthy adult eating balanced diet, it will be normal. And these are a list of positive nitrogen balance that occur in relation to different factors like age, growth, diet, physical exercise, hormones, injury, disease, and stress. It will be positive nitrogen balance in children and those who are overeating. In athletics, they got muscular hypertrophy, and when there is increased growth hormone, insulin production, and in male sex. While the negative nitrogen balance will be negative in expense of catabolism or degradation rather than anabolism or the build. An elderly patient will be negative in old people, as we said, in malnutrition, if there is post-operative cases and an infection, and when there is grave disease or severe disease or chronic disease and in stressful events. While there is no effect, it will be normal, it will be equal. In ordinary exercise, this will not affect the nitrogen balance. These are malnourished children, and the catabolic state or degradation of a protein will be more than the production or the synthesis. And whenever there is reduction in protein content in the body, they will get edema, and you will see here there is leg edema, bilateral leg edema, because of loss of a protein is more than the production of a protein. So what's the recommended protein intake? Average of the adult male and female is equals to the 15 to 20% of the total energy intake, and in form of essential amino acid in quantity in grams per kg, it is 0.8 gram per kg. While for children it requires more than the total required in adult, they need 35% of total energy requirement is of a protein source, and it equals to 2.2 gram per kg for less than 5 months of age. We have for infant between 5 months and 1 year of age, the daily requirement is 1.6 gram per kg, and this requirement will decreases with increasing age. It will be 1.2 to 1 gram per kg till the age of 14, and from 14 to 18 it will be daily requirement is 0.9 gram per kg. We have to remember that the plant source of a protein must be combined to ensure complementary. So we have protein of the animal origin, and we have to add the protein of the plant origin for complementary requirement. How we can calculate the requirement of a protein? We have to multiply the body weight, our body weight in kilograms, by 0.8 gram per kg, and this will equals the gram of a protein required per day. For example, if the body weight is 63.5 kilograms, we will multiply by 0.8 gram per kg, and the result is 50.8 gram protein per day is the daily requirement amount. We heard about vegetarianism. What do you mean? They are vegetarians. They took vegetarian vegetables, and the dietary pattern here focus on the plant protein to provide essential amino acid like the grains, the legumes, fruits, vegetables, seeds, and nuts. There are 2 varieties. We have the lacto-vegetarian dietary pattern. They depend on the vegetables and dairy product. And we have the ovo-lacto-vegetarian dietary pattern. They depend on vegetables and eggs and dairy product. There are 2 varieties. So what happens if we have high protein diet? High protein diet effect. Usually the protein content or intake should not be more than twice the daily requirement, and as it will cause deamination by the liver and increase the keto acid production and ketosis. This will increase urea excretion by the kidney. So it play a major role. It affects the liver and the kidney as well, and it increase their function. Should not allow more than the double requirement, daily requirement of a protein intake. But if more than twice the requirement is taken, this will produce a rapid weight loss by stimulating fluid loss from the body. Sometimes this is dangerous if not corrected properly. And in some cases, the excess of protein intake increases the risk of ill health. And it can worsen the symptom of liver and kidney disease if it is already present. If the patient have uremia or liver disease, chronic liver insult or disease, inborn error of metabolism which affect the kidney or liver, the high protein diet will affect in a worse way, in a very bad way, the sign and symptom, and might end with death. Also, it causes osteoporosis as there is an increased excretion of calcium in the urine. There are certain genetic disorders because of the protein defect. One of these diseases is phenylketonuria, phenylalanine enzyme deficiency. Here the baby born with phenylalanine deficiency, this is type of enzyme deficiency. It affects one of type of the protein. It is not converted, and here they cause mental retardation, convulsion, behavioral problems, skin rash, and mousy odor of the body. And they need not to eat meat, dairy product, and the dry beans, nuts, and eggs. And they should have, and even they should not breastfeed or even taking a normal formula. They have a special formula should be supplied to them. And we have other disease, a sickle cell disease, which is common in our society. So now we talk about the protein metabolism. The protein does not digest it in the mouth, but in the stomach by the pepsin enzyme. Second, we have to remember that the polypeptide, which is digested by the peptidase enzyme converting, it will convert the dipeptide to amino acid, and this will be absorbed to the circulation and then goes to the liver by the portal system or circulation, and then it will send to the tissue for binding. So the oral intake of a protein will change from the big molecule to small molecule to the amino acid, and then it will pass through the circulation and through the portal system to the liver, and then it will go to various tissue for building. In the liver, there is deamination and the transamination, and this occur to synthesis different type of non-essential amino acid. Most of these, if we take a lot of protein beyond our need in excess amount, it will be changed to urea, and it will be excreted through the kidney. That's why the patient with liver disease or renal disease, they should never take a large amount of a protein, and we have to give them protein of high biological value in certain low amount. If the body needed, for example, when there is decrease in carbohydrate intake, that excess amino acids should give energy and they should be oxidized. The amino acid group change to ammonia, as we said, and it will change to urea and excreted in the urine. So in cases of liver disease, we need to restrict protein intake, as well as in patients with acute and subacute renal failure, as there is uremia, and we have also to decrease the protein intake to facilitate recovery. Thank you.